Okay, can we walk through what a quote unquote, like a typical C-section would look like? Like, tell us like everything that happens.
So you usually get to the hospital about 2 hours prior to your scheduled time. You have to get your labs drawn if you haven't gotten them drawn the day prior. You have to get an IV placed. You have to sign consent forms. You'll get some medications before you go into the operating room, which could be Tylenol, which is for pain after surgery. You are put in your gown and ready for surgery. And then another thing people don't really often recognize is you often have to leave your partner or your support person when you go into the operating room initially to get your anesthesia set up, which is usually a spinal for a scheduled planned C-section. General anesthesia is another option. And once you have your anesthesia in, usually get a catheter placed in your bladder, which stays in place for a few hours after surgery. Put monitors on you, so like a blood pressure cuff, and EKG leads, and a pulse ox on your finger. And they have to clean your belly, cover you with drapes. And so then we have to make sure you're totally ready for surgery as far as the anesthesia, and the drapes are up so you can't see the surgery. And it's covering your entire body except for a circular hole in the middle, which is where they actually operate. So there's at least 2 surgeons, and then there's like a tech that's handing instruments and stuff. But as they're pulling the baby up, like we do delayed cord, most of the time these days, baby's still attached to the mom, like sitting on the mom's belly.
I think a lot of people don't realize is that, like I knew every time my baby was delivered because I could physically feel that weight being taken out of my body.